Thank you very much, Jay. It's really a pleasure and also a privilege to be here this afternoon on this very joyous occasion. I must say I had not known anything of Judge Mendez before we met, just before the program began, but judging from his words that he presented to you, there's no question in my mind that New Jersey is indeed, and I mean this very sincerely, very fortunate to have somebody of his wisdom and especially his compassion sitting on the bench. So I applaud you, Judge Mendez, and the state of New Jersey indeed is fortunate to have you as a judge. I don't quite know how Jay did it. I asked Jay to share with me the phone number that she called to arrange for this absolutely perfect weather, but she told me if she gave me the secret, she'd have to kill me, so I let it go at that. But it really is a pleasure to be here. I imagine that there is no more horrendous issue that families face than being basically broken apart. And I mean, it's just really unthinkably tragic when that has to happen. At the same time, it means that ceremonies such as this, where we celebrate reunification, are that much more meaningful and that much more wonderful. And I'm sure that all of you know much better than I do that in order to achieve this goal of reunification, is not easy, and it takes courage, and it takes commitment, and it takes motivation, and it takes support, and also it takes a great deal of good fortune. But when you achieve it, and we have in this room many who have, it's really wonderful to acknowledge it and to be part of a ceremony paying tribute to those who have accomplished this goal and to those who have assisted them in the process. It's almost a shame to start talking about an issue as serious and as just in many ways very distressing and depressing as the issue of substance abuse. On the other hand, there's no question that one of the greatest problems that lead to families being separated as well as health issues and social issues and criminal justice issues and so on, one of the greatest causes, directly or contributing causes, in fact, is the problem of substance abuse and addiction. I think I want to stress a couple of points about substance abuse. First of all, this is a problem that can affect anybody. Makes no difference, rich or poor, makes no difference ethnicity, makes no difference age, makes no difference of family, background. Anyone can, in fact, be caught up in this terrible problem of substance abuse and dependence. And especially in the last 10 years or so, from coast to coast, literally, big cities, small cities, all the states, there has been this massive increase in dependence on prescription painkillers. And as there have been well-meaning efforts to control the supply of these painkillers, one of the unintended, very, very unfortunate consequences is that people who today are dependent and who don't have access to treatment turn in increasing numbers to heroin. And so we have the even more horrendous problem of IV heroin use. And again, these are problems that can affect anyone. They're not problems of one group of people or another group of people. Everybody can be exposed to these drugs and can become dependent and can indeed go on to be addicted. And perhaps the most important message is that we're not talking about bad people. We're not talking about people who are not moral. We're not talking about people who inherently are criminal. Addiction is, and for almost 100 years, has been recognized unequivocally to be a medical condition. 1920, there was an internist in New York City who wrote a book about the problem. At that time, the biggest issue was morphine addiction, and the basic premise from the first page to the last page of his book was that we are dealing not with a bad habit, but we are dealing with a chronic medical condition. And that message was repeated again and again over the years in this country, in England, by the World Health Organization. Anyone who has studied the problem has come to the conclusion we're not dealing with a moral issue, we're not dealing with a bad habit, we're not dealing with people who just want to feel great by sticking a needle in their arm several times a day. We're talking about a medical condition. The bad news is that this medical condition, like so many others, is one that today we simply don't know how to cure. And that might sound depressing, it might sound, overly negative, but in fact, chronic illnesses, by definition, are illnesses that we don't know how to cure. And there's a whole list of them, diabetes and most forms of epilepsy and high blood pressure. And just go on and on and on. There are conditions that can be managed, some better than others, but we don't know how to cure them. And if there's any question about the applicability of that to the problem of substance abuse, just consider Alcoholics Anonymous, the most respected voice in the field of alcoholism management and treatment for almost 100 years. And if you ask an AA advocate, tell me, when does somebody get considered cured of alcoholism? And the answer is unequivocal. It does not happen. So these are chronic problems that we don't know how to cure, but the good news, and the really exceptionally good news, is that addiction, and I'm primarily focused on opiate painkillers and heroin, the good news is that that condition can be treated. It can be treated very, very effectively. There are treatments that people not only are willing to accept, but are desperately eager to accept. They wait for months or longer to receive treatment. And the best news of all, treatment, many forms of treatment, can be extraordinarily effective in helping the large majority of people who get them. So it's a chronic medical problem, can't cure it, it can be treated, and I think that has to be the focus of what we aim to do. The important thing is to consider addiction like any other medical problem, to consider patients who have this problem the same way we consider other patients, and to assess the treatment the way we do in looking at any other form of treatment. In other forms of medical illness like diabetes, if somebody does not stick to a diet, no matter how frustrated the caregivers get with that person, they don't say, you've obviously cheated on your diet, we're going to reduce your dose of insulin. It's unthinkable. And then to go on to say, and if the next visit we do a blood test and again your blood sugar is too high, we're going to throw you out of treatment. Absolutely unimaginable in every field except addiction, where so many providers, unfortunately, say, if you don't cooperate, if you don't do exactly what we tell you to do, we're going to punish you, and then we're going to throw you out of treatment. And that does not help the individual. It does not help the family. It does not help the community. So we have to recognize that this is a problem that we have to look at the same way we look at other problems. Just a word about methadone maintenance, just because it's the form of treatment that I have been most involved with in the past 40 plus years. I hasten to say that there are many forms of treatment of addiction. I support them all. I think that the decision as to which form of treatment somebody should receive should be determined like any other treatment of any other illness. It should be an issue between an informed patient and the patient's caregiver. And that should be the basis for deciding what type of treatment could we expect to be most effective. Treatment should not be determined by parole or probation officers. Tragically, it is very common in many, I'm not talking about New Jersey, but in general, it is very common for officials of the criminal justice system and child protective agencies and others to dictate the form of medical treatment that will be acceptable. if the person is not to be sent to jail. And again, I just have trouble imagining, let's say, a parole officer or a child welfare, a social worker saying, we don't care what the doctor says, we don't care what the approved treatment program thinks is effective, we don't even care how well the record shows you have been doing on a particular form of treatment. We don't believe in it, and either you get off of that treatment or you go to jail. Again, it simply isn't appropriate, and that's why I think there has to be more discussion of what this problem is, what the different treatment efforts are, so that there can be informed decisions that are made. I just want to discuss one other issue very briefly, because I think it's an important one, and that is opiate dependence on the part of a woman who is pregnant. On the one hand, we sort of turn around in horror and say, oh my God, how could you do this to herself? On the other hand, we know that pregnant women do all kinds of things that we'd rather they not do. They drink and they smoke. Obviously, not all, thank heavens. Some of them skydive. Some of them drive without seatbelts. And yet we don't criminalize that. We don't tell them, if you continue to drive without a seatbelt, not only are we going to take your license away, we're going to take your baby away. Well, we're going to prosecute you for whatever horrible things might happen. We don't do that. And when it comes to opiate dependence in the pregnant woman, again, there are many forms of treatment, but one form of treatment has stood the test of time and has been endorsed by federal agencies, state agencies, academic and clinical organizations internationally and here at home, and that is maintenance treatment with methadone and more recently with buprenorphine. And here especially, when there are agencies that say, you're pregnant, you're opiate dependent, you're either going to get off that stuff immediately or I'm going to lock you up in a drug-free facility, that is going against what we know can literally endanger the life of the fetus. That is not an exaggeration. The Federal Substance Abuse Mental Health Services Administration has for years had a very simple 2-page flyer. I'm happy to make it available. And in that flyer it says to the pregnant woman, methadone can save your baby's life. I mean, it doesn't get any clearer. And for government, that's pretty clear language. And yet we have agencies that say, we demand that you stop taking that medication. It's simply wrong. When babies develop abstinence symptoms, and they can be treated. They can be treated well, they can be treated effectively, and there's nothing to suggest that there is any lasting harm to the baby. On the other hand, if somebody is dependent and abruptly stops intake of the drug that the person has been taking, it literally can threaten the life of the fetus. So in closing, I just want to underscore that this is not, as is so often portrayed, an issue where the interests of the mother have to be weighed against the interests of the baby or the children. In general, what is good for the mother is good for the children. What is bad for the mother is bad for the children. On occasion, society is forced to do something it would rather not do, and that is to separate families for the sake of the safety of the child. But when that happens, I think there should be a concerted effort to ensure that treatment is available, that referral is made, that other support, maybe a car, whatever it takes, that support is there to pursue successfully the end that you all represent here, namely reunification. Thank you very much.